good morning all. I am Dr. Suresh Kaul. I head the Department of Cardiovascular Sciences in Amandeep Hospital, Pathankot, and the Director of Cath Lab. And here is Dr. Neelam with me, who is Senior Interventional Cardiologist and with an experience of more than 15 years in coronary care and non-coronary care. We are here to tell you and share this good news with all the people of Pathankot, adjoining areas of Himachal, peripheries of Punjab and Jammu and Kashmir. This hospital has now acquired a new system, the technological advancement in the form of AVVIGO, Boston Scientific intravascular ultrasound and imaging, which is a multimodality imaging, and it will help us. Now, you all of you know that coronary angiography, which is like you give dye inside the coronary arteries and then check with fluoroscopy from outside, and you come to know about blockages. Now, there have been a lot of technological advancements which have come to bigger cities and other bigger towns. What this does is catheter goes inside the coronary arteries and inside the vessels of the heart and sees the artery from inside. And you're able to see exact details, 360 degree, three-dimensionally, and what appears a blockage from outside, which will be critical, sometimes turns out to be non-critical or not significant when you go inside, and you can come to know about calcium, you can come to know about clots, and not many other things which Dr. Neelam will tell you.
So it particularly helps us in the lesions, which we call intermediate lesions. Like on angiography, lesion from outside, the blockage from outside may look very tight. But when we go inside and do the ultrasound, we can see, number one, what is the tightness of the lesion. At the same time, it tells us about whether the lesion is soft, it's having calcium or not, or there are any thrombosis or clots in the artery. And with that, correlating with angiography, it helps us to decide for the better treatment of the patient. And the second thing, very important nowadays, its use is becoming more and more in patients with acute heart attack who have angiographically normal coronary arteries on angiography. But when we do IVUS in such patients, many a times you find that the artery from inside is not good. It's actually having a lot of disease there in the form of ruptured plaque and thrombosis there, the torn arteries, torn पटी हुई रग जिसको हम बोलते हैं अंदर से क्लॉट से भरी हुई रग होती है एंड बहुत बार ऐसी आर्टरी को हम बिना ट्रीटमेंट के नहीं छोड़ सकते क्योंकि ये आगे जाके दिक्कत दे सकती है. सो आईवस हमें हेल्प करता है आर्टरी को अंदर से देखने में. उस केस में डिसीजन ट्रीटमेंट के लिए हमें हेल्प.
इसके अलावा ये जो सिस्टम है, there's one thing incorporated in it, that is FFR. So FFR is a technique by which जैसे कोई ब्लॉकेज हमको अगर क्रिटिकल लगती है बट उसका कोई रेलेवेंस नहीं है जब तक वो फ्लो कम है कि नहीं है. तो FFR is you go in with a wire and you check whether the flow is really decreased. Sometimes you may see a 60% blockage, but the flow is normal and you don't need to do anything to that vessel. Because God has given us all healing mechanisms inside, so you don't need to unnecessarily trouble the vessel when it can take care of itself. Or we are thankful to Amandeep Group of Hospitals, the management, and thankful to Ujala Cygnus, who have thought of getting this technology to this place and benefit thousands and lakhs of people who come here to us for treatment. I'd also like to congratulate people of this place and thank them for the faith that they have placed in us. We'll continue to treat them and may God grace us with all the blessings so that we can help and serve better.
So in nutshell, I would like to say that if angiography is the gold standard, so this IVUS is a diamond in the gold because it helps us in many ways. Number one, it helps us in pre-treatment to diagnose the disease better, and in post-treatment also, after suppose the stent is placed in the artery or the artery is treated, and once you go inside, you again can assess whether the treatment is up to the mark or not. So it is a boon, this place, and the people around, so that this will help a lot of people for their better treatment and outcome.
Thank you so much.
Thank you so much.
Thank you all.